everyone. If you could take your seats, that would be great. Hope you've all had a good break, and welcome back. Just for any of those of you who have only come today, I'll introduce myself. I'm Rona Campbell. I'm one of the deputy directors of the school, and I have a special responsibility for research capacity building, which is just the nicest job ever. And on that front, it is my delight to introduce our next plenary speaker. We asked our early career researchers to volunteer for this plenary slot, and I am really thrilled to introduce Cassey Muir, who was selected to give a plenary presentation. Cassey was a PhD student in SPHR2, and that was a particularly challenging time to do a PhD. But Cassey has done an amazing piece of research, which she's going to tell you all about. And she is now a research associate at the Population Health Sciences Institute in Newcastle. And she's also a public involvement and engagement researcher with the NIHR Children and Families Policy Research Unit at UCL. I think without further ado, I'm going to invite Cassey to the stage and ask her to give her presentation.
Thank you, Rona, and hello everyone, good afternoon. It's great to be here. It's great to give a keynote speak. I've never done one before, so please be nice. I'm also here with my co-star, if you can see from there. So I'm here with Artie. Artie's a bit shy, so she has asked me if I could do the presentation for her. So I'll be doing all the speaking today. So I'm going to be talking through some of my research around co-producing a children's book called Twinkle, Twinkle, Artie. And this is for children who experience parental alcohol or drug use. Has that moved? There we go. So I've got a bit of audience participation, but in the spirit of SPHR's annual scientific meeting, rather than raising your hand, I'm going to ask people to stand up. So if these statements apply to you, please stand up. Too early. So the first one is please stand up if you have ever read a storybook to a child. Now, if you want to look around, you realise that actually quite a lot of you have read storybooks to a child. Now, either stay standing or sit down or stand up if you've done the following. Have you ever had a conversation with a child about that story or the characters within it or the themes within that story? So pretty much most of the people in this room, so please do sit down now. This is really to show that storytelling is a powerful tool to connect people together, especially with adults with children. We can distill really big or complex or difficult topics, themes, or ideas into really fun narratives, and like Twinkle, Twinkle, Artie, with some really fun illustrations as well. So in the spirit of also telling stories, I'm going to tell you about Jake. Jake is 6 years old. Jake is one of nearly 500,000 children in England who live in families where there is a reported alcohol or drug dependency. Jake sees his dad using alcohol most nights. He also sees his dad sometimes doing drugs. Jake doesn't really know what alcohol or drugs are, but he knows that it has an impact on his dad's behaviour. That makes him feel really sad. He also sees that his mom's really sad as well. Jake doesn't really have anyone to talk to about this. Nobody in his family talks about it. Nobody in school talks about it. None of his friends talk about similar experiences. Jake did once ask his mom what his dad was doing, and his mom said, "Oh, that's nothing for you to worry about." Jake doesn't have anyone to have these conversations with, so as the quote says on the screen, he gathers all of his soft toys in the bed, turns off the lights, and tells them his worries. This was a finding across my PhD, that a lot of the time the children and young people didn't have anyone to speak to. They didn't have anyone to trust. They would talk to teddies, their pets, and that was just not enough. It's a massive taboo subject. There's a lot of stigma and shame in these experiences. We know that there is a wide range of impacts on the social and emotional well-being of children and young people. Yet the interventions, they're very limited in terms of directly for children. Most of the interventions focus on the parent themselves to try to reduce the risk to the children. But actually, a lot of the young people that I spoke to, even if their parents had stopped using, that impact on their emotional and social well-being was still there. And oftentimes they weren't supported. We also know from doing my research that there's not a lot of information or research around what support to children and young people actually want. So that's where I kind of used my space and asked young people what is the support they want. So in development of this book, 2 projects came together, both SPHR funded. The first one was Safe Space, and that was led by researchers at Newcastle University and Dr Ruth McGovern. This was very much around trying to understand perhaps what the non-using parent or caregiver might want. So they spoke to practitioners, they spoke to parents and some children. My PhD focused much more on the children and the young people and what support they wanted, what were their experiences and how were they impacted. I spoke with young people from across England, so it was done during the pandemic and it was all remote. I also spoke with practitioners who had a focus on children and young people and trying to support young people within those families. And then also, finally, I did some co-production workshops, and that was all around prioritising the different ideas and support needs and intervention ideas that young people had told me in the interviews. And some of those priorities and the findings from Safe Space came together for this book. So in terms of the Safe Space project and the non-using caregiver, they told us that they didn't know how to talk to their children about parental substance use. They wanted to protect their children from that. Oftentimes they thought it was too hard, or when was the right time to talk to their children about their other parents' substance use. There was anecdotes about their children asking them in the queue at McDonald's if someone had come in drunk. They'd asked about, oh, that's similar to dad or mum. And that was really awkward, and the parents never really knew how to broach that subject within that time. Based on that, parents told us that they wanted support and they needed a support to start those conversations. Similarly with the children and young people, as I kind of sort of mentioned within the story of Jake, nobody talks about parental substance use, and that made the young people feel really alone in their experiences. They felt really different to their peers. Nobody else had similar experiences, and nobody understood what it was like for that child from their perspective about their experiences. The young people told me that they wanted it to be talked about. So with regards to the parents, that was more within the family home, but young people said they wanted it spoken about at schools. They wanted it spoken about throughout primary and secondary school years. They wanted that conversation to be had that was in an approachable way and applicable to the age range. One of the ways that was prioritised in those in the workshops was to develop wellbeing resources within schools, and that was really around, in the primary school age, to develop children's storybooks. And this would help to have conversations between trusted adults and children, but also show the impact and the experiences from the young person's own perspective and possible solutions that they could have. So that's where the co-production of the book came in. I don't know if people can see the book from the back row, but this is the children's book. It's got lots of fun illustrations in. We applied for the SPHR Impact Accelerator Award to co-produce this book, and thankfully we were successful, and we've been doing that over the past year. So for us, collaboration was key. This was very much around working with a wide range of different perspectives, a lot of public involvement and engagement. We've heard a lot about that over the past few days. We worked with a local children's illustrator and author. They had a lot of experience in working in developing stories for children, where there might be mental health problems, or they'd also worked in some things around adoption. We also worked with the 15 family members with lived experience. We had children in our age range, so from about 5 to 8. We also had children who were in their teen years. We had some young adults who could reflect back on their experience. We had parents who used substances as well as parents who did not use substances. And it was very important to us to have all those perspectives to try to make sure that we weren't stigmatizing any one of those members. We also worked with practice partners throughout my PhD and throughout the Safe Space. We had different health and social care practitioners, as well as voluntary and community organisations. But for this study specifically, in developing this book, we worked with Quorum. Quorum is a children's educational charity, and they really helped us think about how this could be applicable within schools. We also worked with 3 local primary school teachers to make sure that it would work within their kind of classrooms, that the language was right, that some of the prompts, which we'll see later, worked for having those conversations. As part of the research team, we also had a parent involved as a co-applicant, and one of the young adults helped with facilitating some of the workshops with children and families. So how did the book come about? Because it was very different from my thesis and definitely very different from the research reports that we wrote for the other study. This started by trying to distill some of our key messages and findings and giving that to the author and illustrator. That was a safe space for them to ask about what kind of language they should use with parents and families, but also give them a chance to ask us questions and us to ask them questions too about what kind of artwork that they usually do, what's their kind of writing style like. From that, we then did workshops with the parents only and parents and the young adults, and that was to try to understand their perspective and needs from the book without having their kind of children there. They could be open and honest with each other. After that, we then brought the children in, and we had children and parents together in creative workshops. So as you can see from the photos, that's some of the kind of things that we used with the family workshops. We had paper out on the tables for free doodling and drawing of some of the characters. We had sticky notes with things placed around the room where they could come up with different names and personalities, likes and dislikes, who those characters might interact with. We also had some worksheets with regards to character development and specific ones that we wanted to focus on. We also did some creative writing and free writing to music, which was sort of twinkly star music. So this really helped with developing some of the key sort of design ideas and storyline elements. We agreed on the theme of stars. We all knew that we didn't want to have people in it. It was supposed to be more inclusive and show diversity. And the next part was really trying to develop those characters. And this was a very long, iterative process to make sure that we got the right characters. We needed to try to depict who the child would be, and that is Artie, who you met earlier. That was a bit more of a linear and easy process. It was a star. The parents and children kind of came up with ideas about that. Josie, our illustrator, went away and kind of came up with some other ideas based on all those ideas. Families, children, parents could then vote on which characters they wanted. And then we had the final character of Artie at the end there. The adults were a little bit more complicated to do. We knew that we wanted to represent the parent who used substances and also a parent who didn't, or a caregiver, or another trusted adult within that family. That started off as being what we'd described as a star sweeper, someone who kind of comes in and sweeps up and protects. So the images go through a bit of a change. But actually, when we had those images, especially that middle one, we realised that with the families and the children, it didn't really make sense They wanted it to be more of the same species, so we changed that to a star. We also had to think about how we depict alcohol and drugs in the book, and we chose to do that through a fictional character rather to have alcohol and drugs in the book. We don't talk about alcohol or drugs. That is depicted through a yozzle, which is completely made up by one of the children, I believe. And this is more of a meteoroid-like character that created havoc and chaos within the story, but also for one of Artie's big stars. Along with the character development, we also had to think about the storyline and how all these characters interacted and what was going to happen. So this was, again, very iterative and back and forth with feedback from families, parents, and children. So we kind of ended up with a script from the author, which we went and read to the children and the families. They could then give us some feedback. We got feedback from children. We got feedback from the parents. Most of that was around kind of cutting it down, making sure that it flowed easily. Once we kind of realised what the kind of story was, we could then storyboard it, which Josie did. And this was very much in sketch form. Again, we could then take the sketch form to the children and families. And again, they give us their feedback on some of the placement, getting rid of some of the text, as well as what they wanted to see within regards to the colour. So the next part was really about building up the different colours within this world. And Josie came with a palette of colours, which we got feedback again from families around what their preferences were in terms of colours and what the characters looked like, what the world in the background of the pages looked like. From that, we were able to develop a prototype of the book, which we printed out and again went back to families and read that to them and showed them the work that they'd been working on. And at that point, they were really proud and super excited, with one of the children saying, "I can't wait to share this with my teacher," which is just amazing. Like I said, we also worked with practitioners, especially within education. And as this book was all about having conversations, we developed conversation prompts at the back of the book. And these were very much around the different characters, the themes within the book. So some of the questions there, if you were Artie, how would you feel? What does the yozzle remind you of? Are there any other big stars who you would feel happy to talk to about your worries? And these are kind of questions to help teachers, guide sort of classroom discussions, one-to-one discussions. It also helps parents as well. So I think that's too small for me to read, so I've got the book here to read the blurb to give you a bit of a feeling of what the story's about. The sticky notes show you the kind of where that idea came from the children and parents. So there is a little galaxy not too far from you on Earth. In this little galaxy live thousands of young wishing stars, getting ready to grant their first wish in order to get something important, their twinkle. If I had sound effects, it would have been good to have a twinkly noise there. But one wishing star, Artie, is finding things a little bit hard. Life is bumpy and things just keep getting in the way. Things like the yozzle. Artie is sad. Artie is frustrated. How will Artie get her twinkle when she isn't able to grant her first wish? So I want to talk through some of the themes from our research and how that translated into the pages of the book. So I've got 5 here to talk about. The first one was really we want to identify the indirect impact of parental substance use upon the child, that these children were impacted, whether it be kind of through small ways or through big ways. And within the book, Artie is impacted by the yozzle having an effect on Big Star. And piles of dust go on Artie and stops her from getting her twinkle. We also wanted to recognise children's own strategies. My PhD focused on children and young people's agency in their experiences, that a lot of the times is missed within the research. These children, as young as 4, were saying that they tried to control some of the unpredictability in their families by throwing away alcohol, throwing away drugs, hiding money so their parents can go out and buy substances. And we really wanted to acknowledge that within the book. So Artie comes up with plans to trap the yozzle and throw it away. We also later in the book have a message around the fact that it's not the young person's job or Artie's job to solve all the problems in the galaxy. While this is a book for children, the parents are likely to be reading this with them. So we also wanted to acknowledge the adults' experience from our research. And that was around a lot of the parents that told us that they tried to protect their children, they tried to hide things that are happening in the home. So other big star in the book has lots of tools, and that's to protect things, build things, and I can't actually read what that says, with their tools. And that's proven handy to try to hide away and sweep away the mess that the yozzle had been making. And that really reflected the other parents or caregivers' perspective within our research. The whole book is about making it safe to talk. So of course, Artie has that experience as well in the book. And this was really to try to make it seem like it could be a positive experience, having those conversations and talking about what it feels like to live in those experiences, and that it's okay to feel sad or frustrated. So Artie has the conversation with other big star. One of the final themes I'll talk about is making sure that the child know that they are not alone. A lot of the times, children, like I said earlier, they feel really alone and different in their experiences. And this is reflected in Artie towards the end of the book, realising that there were other young stars who had just got their twinkle as well. Since working on the book, we've also developed a storytime video, which I wish I could have done something fancy and played it for you, but every time I tried to embed it, it's about 10 minutes long. It kept crashing my computer. So please do go to the YouTube channel, which is on SPHR's, or Fuse's channel, where you can watch the video. And this is very much that the author, so Danielle, reads the story out loud with some of the illustrations being shown in close-up. Very much kind of like a CBeebies style. I've already had comments this week saying that I should get in touch with Tom Hardy for him to try and do this on CBeebies. So this was very much working with Newcastle Film Club. They did this, and the two people pictured in the image are both teachers, and this was a voluntary thing with the Newcastle Film Club, and anyone could help develop this video. And those two kindly came forward, and they just really saw the need for it within schools, so they took the books away as well. One of their friends and colleagues have made the Artie toy for us as well as a gift. So yeah, please do watch the video. We launched the book in January, and we've been trying to share that with as many children, families and practitioners as we could. That's all across England. A lot of our research was based across England, so we've got those ties with practitioners, but we're always open if there's anyone that you work with in research, or if you are a practitioner or a family member, then please do get in touch with me. My email's on the bottom there. We can send out a book, it's free. We've got a PDF version online, and also the video. We've been working with AdFam, Quorum. It's gone all the way to Ireland through Alcohol Action Ireland, did a piece on it. Some of our local organisations, including Props, did blog posts on it. And we've been receiving feedback through an online survey, but also through word of mouth, emails, and this is some of the feedback that we've received so far. A child said that the story shows that you're not on your own and that there are others to support you, which is brilliant because that's really what we wanted it to be. Practitioners said there could be, it's so meaningful for children to know about the yozzle. What a very complex idea to get across to children, and yet it's been achieved with such skill. And I can't take all that credit. That was definitely the collaboration and the co-production, the public involvement engagement in that project. All the different perspectives have hopefully led to that book been shown in such skill. Teachers have also said that there's no problems using it in a whole class situation. Actually, you can discuss lots of other things, mental health, feelings, how to overcome problems. And I think that's one of the key strengths of this. We don't actually talk about alcohol or drugs. And we've had a lot of feedback saying that it could apply to lots of other settings: mental health, parental mental health, domestic violence and abuse, poverty, any other kind of adversities, or just talking about feelings. We've also had lots of feedback from practitioners and teachers about how to kind of extend this work and what we could use as well as that. So things like puppets or plush toys, which unfortunately we haven't got for the families, but we do have that we can take to workshops in future with children. But also things around kind of developing puppets or worksheets. And also a parent who was involved said, "I'm proud of the book because other children won't have to go through what my children have." And I just want to end on the words of Kira. I might just let you read that so I don't have to squint to see that. But this was really, so Kira is one of our young adults who worked with me on my PhD and has also come along to work on the book. And she reflected this passage around this was doing this for her little me, and being able to give voice to the children that she never had that voice when she was a child. And that she really hopes that the book is able to show children they're not alone, that there are people around them who are there to give them love, and hopefully the book can help reach them earlier than she was reached to. So thank you for listening, and that's me finished.
Thank you, Cassie, for that absolutely beautiful presentation as a masterclass in how to do a plenary presentation. I think your talk just epitomises everything that we try to do in the School of Public Health Research, undertaking high-quality public health research, co-producing our work, and doing it in a way that's incredibly thoughtful and inclusive, and impactful, and really making a difference, particularly for those from marginalised communities.
Thank you.
Questions, anyone?
Hi, thank you. It was gorgeous. I have a question about artistic control. I used to be a literary agent, and we only had a small children's authors list, but I would say that they were the biggest creative divas in the whole list. So seems like that wasn't an issue here, but I was just wondering whether sometimes there was a bit of tension. You had to kind of negotiate with what the writer and illustrator wanted.
Yeah, absolutely not. That was completely different for this project. Danielle and Josie, because they'd worked in, so their writing and their work is very much around that kind of trying to make a difference for their audience members. They'd worked a lot with children and families. They're currently doing a book around refugee communities, and it's very much trying to translate those findings and that message and that research to the communities that are going to get benefit from that. So actually it was a really fun and collaborative process, understanding from their perspectives and what they could bring to it, but also what we really wanted to get out of it as well as the families, the parents and the children. So yeah, and in terms of kind of distribution, it is a free resource. We all kind of own the right of sharing that and disseminating it. So the author and illustrator are also currently showcasing it as part of their work and portfolio. Some of the children and the young adults, the young people, are sharing it amongst their networks. So Kira, that I've already spoken about, she has given it to her primary school and opened that conversation about what support she could have had when she was a child. We also are getting, hopefully, more funded through our Newcastle local authority. The harm reduction team have asked if they could print some that they can share with families across Newcastle, as well as their services and libraries. So we've got about 200 copies left, or just under, for services across England currently.
Great, yes, Rebecca.
Thank you, that was very powerful. Just a quick question. I just wondered if you'd had any feedback or involvement of the parents who are using substances, have problems with substances themselves, and what their reaction was?
Yeah, so as part of the project, we had a couple of parents who had used substances, so had not currently, and that was very much their involvement was about trying to make sure it wasn't stigmatising. So there were some elements within the book that we changed. So for instance, the yozzle was called a menace at first, and they thought that that might have stigmatising qualities of what kind of menace relates to, but also trying to show that there was positive aspects of that character, or that the parent. So we have that kind of reflection. Within the book, there's also good times had with that parent. There's also reflecting back on happier times. And also the end of the book is about Artie feeling safe in her experiences. So yeah, but we would love to have more feedback from parents who use substances about how the book is either helpful or things we could change in future. Thank you.
Okay, thank you so much, Cassie. I'm really sorry. I know can see there's lots more hands going up in the room. But I am going to have to call it there. But Cassie will be around for a little while longer. Yep. So please do catch her after the end of this session. But thanks again, Cassie, for just a wonderful presentation. So for our final session today, we're returning to our research programmes, and we're going to have a session now on the Health Inequalities programme. That's a programme that's led by Jenny Poppe, and at the moment also led by Judy Green. my brain went blank there for a minute. Who is standing in for Claire Bamborough, who, as you heard earlier, is unwell. Unfortunately, Jenny, we were expecting Jenny to be here today, but unfortunately she hasn't been able to come today. And so we're incredibly grateful to Rebecca Mead, who has sort of stood in at the last minute and is going to give the overview from the programme, but is also going to be presenting her project herself. So thank you so much, Rebecca, for doing that, and we're really looking forward to hearing what you've got to say.
Okay, yes, thank you everybody. I did have a slightly more notice than Peter got yesterday, because Jenny did make me aware that she might not be able to make it yesterday, and she did send her apologies. She's unwell. Also, just to say that I didn't intentionally brand myself today to SPHR's colours, but this is a happy accident in my outfit. So I'm Rebecca Mead. I'm a researcher from Lancaster University, part of Lilac, and I'm the programme coordinator, which is a role I share with Viviana Albani, who's sat down here. We're the programme coordinators, and we support Jenny and Claire and Judy with the programme. So just a quick overview of the programme. Our aim is to produce high quality evidence to support a step change on action on the social inequalities driving health inequalities. And so we use that language intentionally to have social inequalities up front in the way that we're thinking about our research programme. Our objectives are to evaluate equity impacts of policy and action addressing social determinants, co-create evidence with groups experiencing social and health inequalities. And we've heard about some great examples of co-creation research over the course of the meeting. Work with intersectional or a range of partners to maximise evidence, relevance, utility and impact, and to strengthen an intersectional equity lens in research. And Jenny has popped the For Equity here, so I assume she intended to plug For Equity, which I will now do, which is a website where you can go and get lots of interesting resources about applying an equity lens to your research. And also, if you have completed or written a research proposal, you will have had to submit a health inequalities impact assessment tool alongside it, and those are there, and works you through a process to look at your research and ensure that you've got health inequalities or social and health inequalities integrated throughout as you're considering your research ideas and public involvement. So the programme vision, is to have a real impact on reducing health inequalities and structural inequalities driving them. So we're all very aware that prior to the pandemic, health inequality was actually getting worse, and now pandemic and the economic crisis is exacerbating that. Also, to have a step change in public involvement in health inequalities research. So we have heard some amazing examples of great public involvement in research, not least the presentation just prior to this one. But we also heard yesterday about how marginalised groups are often overlooked or not adequately engaged as partners in research into inequalities and actions to reduce them. So that's something that we wanted to focus on as part of the programme. And a demonstrable improvement in equity-sensitive public health research. And Matt Egan earlier referenced this in his response to a question about sometimes when you do a systematic review, there's actually not enough information about health inequalities in the research that people are doing, thinking about interlocking forms of oppression and how they affect health inequalities. Often that information is just not available. So a real push to try to improve that health inequalities or health equity lens, coming back to the 4 equity tool. But in the programme, we wanted to have an explicit focus on reducing structural inequality, driving health inequalities, and that's what we've taken forward as our research programme next. So the programme structure, we have had a preliminary phase. So for the first 12 months, we wanted to spend a lot of time really grounding our planned projects in some preliminary work to ensure that we're meeting those research goals. So we've been doing that over the last 12 months up to now. And we've had 2 work strands doing that. So we've had the Levelling Up and Pandemic Recovery work strand, which I'm going to talk about briefly, and then the work strand on co-creating knowledge with minoritised communities and groups. So last year, I think quite a lot of information was presented about the Levelling Up work streams, so I'm just going to briefly cover that today, and most of the programme is going to focus on the co-creation element. So we've just recently had our second phase of projects approved, so there are a number of linked projects reflecting the priorities that we identified as part of that preliminary work. So for work strand 1, evaluating the impact of policies aiming to reduce social inequalities driving health inequalities, and this was very much focused on the Levelling Up agenda, which you may be aware of has been championed by Michael Gove, looking at economic recovery from the pandemic as well. So this was some work led by Jenny, Claire and Emma Halliday as well, and you can see some of the partners. We all know about life expectancy gaps, so I won't spend too long on this, but can be up to a decade for men in life expectancy, depending on where you live and grow. And through the pandemic, death rates were 2 to 3 times higher in disadvantaged areas. So there's a real need, as we've heard over the last 2 days, for work in this area. In 2011, the Levelling Up agenda began to emerge, and there has been a raft of national funding streams and local action from then onwards, and a formal strategy published 2 years ago to try to galvanise action around levelling up. And as we'll hear, we're not really sure still what that is. So there's quite a lot of information summarised in this slide. It's the one I was least looking forward to presenting. Because we did quite a lot of this work last year, we've just tried to summarise it quite briefly. So part of the work was a mapping exercise. So we took 15 local authority areas from the bottom half of the indices of multiple deprivation, and looked at actions and policies that meet the aims of levelling up or addressing the wider social determinants of health, and did a kind of typology of those policies. And there were so many, it was very difficult to condense down, and we produced this typology. And also identified the funding streams that have the potential to contribute to levelling up as well. And there were over 45 different funding streams associated with levelling up, so it's a really complex area. We also had a number of workshops. So we have 4 workshops with 62 participants, predominantly practitioners, and we also had members of the public involved in those. And those workshops were focused on trying to unpick levelling up as a catalyst for intersectoral work. There were a lot of critiques of the concept of levelling up, the opaqueness of it. There was actually a reticence to use the language of levelling up in local government, and a concern about how the money was being targeted or not targeted in areas of deprivation. And community members, our public partners, were particularly critical of a lack of community involvement in the levelling up agenda as well. So bringing that work together, I've missed 2 of my work packages. So another piece of work looking at data impact pathways, and this comes back to the lack of information about intersecting forms of social oppression, and then how the pathway from data gathering through to dissemination is influenced by structural inequalities in itself. So some of the ways that information is presented, for example, can actually impact. So it's looking at the data impact pathway from the beginning to the end of the research process and dissemination. And a scoping exercise on data sources that might help us to answer some of these research questions from a big picture perspective. So Viviana and colleagues looked at over 100 sources of secondary data and how that might help to answer some of these research questions. And through that work, we've developed a number of linked levels of research. Follow the money. This is led by Viviana and Alexandros Alexia from Liverpool, looking at population-level impacts of national policies aimed at promoting local economic growth in disadvantaged places. So broadly, the aims of the project are to understand the impacts of local growth funding on the social determinants of health and population health, so things like housing, employment and well-being, for example. And to what extent the growth funding actually affects health inequalities. So hopefully at next year's annual scientific meeting, you'll hear more about the outcome of some of the early work from that project. The second level is looking at the system. And again, over the past 2 days, we've heard a lot about systems thinking in our research. And this project, I think we're trying to take a slightly different angle. It actually came from a lot of the work in the workshops where our practitioners were telling us that they're increasingly being asked to take a whole systems approach and use whole systems thinking, but at the same time, there are all these different initiatives. So as you heard about the 45 different funding streams coming into local authorities. So the idea is to look at the system as a whole and think about the conditions and properties of the system itself, the public health system, and how they are part of the environment that an intervention might go into. So rather than starting with the intervention in the system, thinking about the system itself, which obviously is quite a challenge. And then also, as I alluded to, our practice partners our public partners were concerned about the lack of public engagement in the Levelling Up agenda. And so there's something about the lived experience of local people and frontline practitioners in terms of that Levelling Up agenda, and understanding the real impact on their lives. As we know, there's often a mismatch between policy intentions and what actually happens on the ground. And so to understand that better, we need to speak to people about that. So that was a whistle-stop tour of Work Strand 1. I'm now going to move on to Work Strand 2, but I'm not going to spend too long on this because we're going to hear from 2 of the projects in Work Strand 2 for the rest of the session. The aim of Work Strand 2 was to really focus on minoritized and marginalized communities and mobilize evidence to shape policy among groups who are often absent from research. Sarah Salway was leading this piece of work along with colleagues, and Lois is here today. She's going to pick up and present the research from that perspective. Initially, there were, it says 3, but there were 4, not my slides. There were 4 knowledge partnerships, racial and minoritized communities, people with learning disabilities, marginalized rural and coastal communities, and people in contact with the criminal justice system. And the idea was to really reach into those people, those communities and groups to find out what matters most to them. There was a very big contribution from the voluntary and community sector, with lots of local authority staff and other staff from the public health system involved. And as I said, the main aim was to establish relationships with these groups. I think for some, that was about creating relationships between groups of people. And from the work that I was involved in an area where historically in the rural, an isolated geographic community, has not been much academic research in that locality. So it's about firstly establishing those relationships in that area, and then building partnerships in order to then go on and identify priorities with those people. That led to 2 projects, potentially 3 going forward from this piece of work. I have a minute left. So we're going to, I should just say, for anybody who wasn't here yesterday, Kaya, instead of having the boring, you have 1 minute left, decided to bring along a bubble machine. And so if you weren't here yesterday, that's why I'm having bubbles blown at me to let me know. So we're going to hear from Clarity, a collective reimagining of community-led public health evaluation from the perspective of racialized communities. And we're also going to hear from Magdalena about the belonging and difference people with learning disabilities. Okay, so now I'm going to hand over to myself. This is where this is where I should have been picking up the slides. So I hope I did Jenny's slides justice there. So feeling safe and like you belong as a research priority for marginalised communities, we actually decided to combine some of the knowledge partnerships in this work, as you'll hear. I just want to briefly bring attention to the people, all the people who have contributed to this work, who some of who are here today, some of who aren't, but as you can see, there are a lot of people involved, and just wanted to mention those. So safety and belonging, just to highlight and remind you, I was going to remind you that what Jenny said, but I'll remind you what I said, that the purpose was to engage people who've not previously had any significant influence on research and to identify research priorities that matter most to them. And what was really interesting is that the theme of safety and belonging emerged as a priority for 3 of the 4 knowledge partnerships. So learning disabilities, rural and coastal communities, and people in contact with the criminal justice system. So we can see that it's a really big issue for people when they're asked themselves what it is that they want to focus on. And also in the area that I was involved in, belonging has been taken forward as a priority for the Poverty Truth Commission, who we've been working closely with as well. So it's a real issue that people wanted to address. We had a series of workshops, meetings and one-to-one conversations across the different partnerships and used different methods. Here, this is from a sign making workshop, which it's the first one that I'd run, and I was incredibly nervous. I don't know if that came across on the day about how it was going to go, and it was really great. But what was most important about that was the way that it facilitated conversations. And we've got some illustrations of the work that we undertook on the day, but it wasn't so much what came out of those that was important. It was the conversation that we had around the table, and I feel like people were able to have really open discussions through that process. There were lots of positive examples of people's having their needs met, but also lots of negative examples as well. I'm not going to give you any because we've got one of our public partners here today who's going to talk about her experience. But firstly, we needed to take that priority away and think about what we already know. What we already know from the academic literature about safety and belonging is that it's an important determinant of health in and of itself. So just feeling like you belong in an environment is good for your health. It's influenced in the same way as health inequalities themselves are influenced by the structural and social economic factors, wider factors. Safety is associated with control over your body and control over your environment. So the more control you feel like you have over those things, the better it is for you. It's also associated with stigma, and there's a lot of literature on stigma, but what we were keen to do across all of the knowledge partnerships was focus on positives and assets, to taking a positive approach. So focusing on stigma does leave you with a tendency towards focusing on deficits. So although we are obviously going to engage with that literature, we want to think about belonging as our area of interest rather than stigma. And also it's inherently intersectional. So we've heard about those interlocking forms of oppression, and as they intersect for health inequalities, they also do for how people feel like they belong in their environment or in the services when they're engaging with them. What does this mean for health inequalities? So improving a sense of belonging among marginalised communities could reduce health inequalities by improving the balance of relationships between professionals and communities. Sometimes feeling out of place is influenced by dynamics, just the atmosphere and also the physical environment when engaging. So improving that understanding between both parties, which is an aim of the Poverty Truth Commission, who we're working with, could potentially reduce health inequalities. We often problematise the people who are accessing institutions and come up with ways that they can be supported to engage with the current infrastructure to meet their needs, rather than thinking about what the systems, organisations and places that people engage with can do to recreate the conditions that make people feel as if they belong. And that's what we want to do with this piece of work, is focus on that sense of belonging and recreating those conditions that then can be applied in other settings. And by doing those things, we may improve relationships and influence institutions. So, as I said, we're going to have some examples from Hayley about her experience of belonging. So Hayley, if you want to come up.
Hi everyone, thanks for having me, by the way. I'm going to start off with the bad experiences we face with using support services in our area, and that started with being unwelcoming, unpleasant atmosphere and surroundings, discrimination, judgment, lack of empathy and understanding, not being heard properly, having a dismissive attitude towards the service users, not getting the right kind of help, and just seeing the work as a paycheck and not caring about the work you provide or the people you're providing a service for. The good experiences we faced from support services within our area, for an example of our families that were set up quite a few years ago, started with, as soon as you walked through the door, you were welcomed with a smile. There was non-judgmentalness of the staff members, the friendliness of staff and other service users that were in the building, the willingness to help from staff, the fact that the staff actually listened to what you had to say, the safety and comfort of your surroundings, the right kind of help given and explained in a way that we understand, and the genuine love the staff had for the work that they're actually doing for the people who were providing a service for. The health and well-being side and how the bad services made us feel at that time with the discrimination, the judgment, lack of empathy, dismissive attitude, all them things to a service user affect state of mind. It's hard enough to ask for help in the first place, and sometimes even harder to get out of bed in the morning, especially when you're in a bad place. People wouldn't want to use that service, they wouldn't want to seek help, and they're not going to want to use a service that treats you as a project rather than a person. The experiences we've had from the good side, for example, Love by Our Families Again, changed the way me and my colleagues as we are as people today. The welcoming, the willingness to help, and the genuine kindness of the staff made a massive difference. The families and friendships that were formed within that service turned into families wanting to volunteer to make that service an even better place, which then in turn gave the people the courage to help one another, and we had families helping families on how to deal with certain situations. So, as you know, a co-researcher's role is to study and discover new information with one or a team of people. Mine and my colleagues' role as a co-researcher bring lived experiences from using a support service and bring more insight and research to those who've never used a service. As past service users, we know more than most what it's like to be on the other side and what changes may need to take place to improve that service. One researcher may not have a solution on how or what might need changing, but for example, 100 co-researchers with lived experience of using that service with 1% of a solution will get the job done, or hopefully get it done properly. Thank you.
Thank you so much, Hayley. As you told me to reiterate how good it is to hear from people who have been involved and have lived experience of the issues that we all want to address as practice partners and as academics. Finally, we're going to hear from Magdalena briefly about one of the projects that's going forward in relation to learning disabilities. So, thank you, Magdalena. Thank you. Thank you.
Can you hear me all right? Am I in the right spot for the microphone? Step forward, I thought so. I'm short and disappear behind it. There. Thank you. Thank you for having me. A quick disclaimer, I'm not a public health researcher, so this is an interesting experience for me to be here. And thank you for having me and involving me in these discussions. So I'm going to talk about what's next for the Learning Disabilities Knowledge Partnership, which was part of the project Rebecca so eloquently described. We have a knowledge partnership that consists of 17 people at the moment. More or less people come and float in and out as well. But these are people from 4 universities and 4 community organizations. They were on the slide earlier on when Rebecca was talking about the partners. These are People First Dorset, Calendar Self-Advocacy Network, Changing Our Lives, which is based here in Midlands, and also, I'm forgetting one, it's always the case, Sunderland People First. So through our co-production phase 1 project in Workstrand 2, we had lots of conversations with people around social determinants of health, and having conversations with people learning disabilities about social determinants of health is not something that's kind of your standard practice in research. Even explaining what social determinants of health are to people with learning disabilities is an obstacle in and of itself. And I think there's a lot of barriers to people with learning disabilities, even who are part of research on a kind of routine basis, if you like, to taking part in public health research. So this is very new for myself as a co-production orientated researcher, and also to the partners that we've been working with. But we have managed to arrive at a research priority through these workshops and meetings and conversations we've been having with partners around the country, community groups, self-advocacy groups, individuals, and health professionals and many other people, like Rebecca has indicated. And our next steps are really about kind of bringing a project that we visualized and thought out together and making it reality, and it has been approved for funding, so we're really excited about it. The project focuses on belonging, as Rebecca indicated, and it's looking at kind of disaggregating the experiences of people with learning disabilities in relation to belonging and thus in relation to their health. This is because a lot of the literature around learning disabilities homogenizes the experience of this group, wrongly so. And as you've been hearing about today, and I'm sure yesterday, which I unfortunately missed, intersectionality is a real concern in research, and we should be doing research that is intersectional and attends to these differences in a way that gives us meaningful data and meaningful evidence for the kind of interventions and policies that we're hoping to inform. The project that we arrived at with our Knowledge Partnership is called Show Me How and Where You Belong, Belonging and Difference for People with Learning Disabilities. And it is that positive lens of taking kind of experiences that are of feeling like you belong, of feeling like you're not out of place, of feeling like you're not the right kind of person in the room, and kind of finding out through mixed qualitative method, what they feel, look, and where they happen. I've been thinking throughout today when people talked about nighttime economy and all these other experiences that we take for granted as people without learning disabilities, that a lot of these spaces and places are actually not available to people with learning disabilities in the same way as we might imagine they are for others and us most of the time. We are carrying on our work of co-production. So from the phase one and the community partners that we've been working with, we had 5 community researchers who are going to stay with us. We're also hoping to expand that group to bring more intersectional kind of lenses into that group. So we hope to continue to do that. The organizations are staying with us, as I mentioned, and we're going to be looking at specifically the experience of women with learning disabilities in relation to belonging. This has come out as a theme through our conversations with the groups we've been having around the country, the kind of difference between how safe, how comfortable women with learning disabilities feel going to places, being out, or in fact just leaving the house after a certain time in the evening. And this has been quite striking to talk about to people around the country about. And it's also that kind of often again, taken for grantedness of sexuality and people with learning disabilities that is not talked about. There is some small amount of research that looks at that intersection, but often again, when you look at the literature on belonging and health, it doesn't actually look at the specific experience of people with learning disabilities who might be also lesbian, gay, trans, bisexual, etc. Thank you. And finally, we have ethnically minoritized groups. So this is, again, a big issue, and I'm sure if you are aware of the leather work, so the report that looks at kind of causes of death for people with learning disabilities, this has been a major problem, and also the kind of striking disadvantages at which people from minoritized groups are, people with learning disabilities, are evident in the literature and in the research that's there already. Thank you. I could have the next slide. Is there a next slide? No, that's it. That was actually very good. I was worried there was one more slide, so I might have spoken a bit too fast. Thank you.
Okay, so now we're going to hear from Lewis Orton about the Clarity work that's been taken place and now being taken forward as Clarity Plus.
Hi everyone, so I'm aware I'm kind of pretty much the last person on the stage today, so I'll try and keep it to the point. And you've heard a bit about the whole project as a whole already, so I won't go over kind of what Clarity is about, but I'm going to provide a few reflections from the racially minoritized substrand. And I should acknowledge as well my colleagues who aren't here. So Sarah Solway was originally the lead for this work. I've been involved from the start, but I've become much more involved since Sarah departed academia, unfortunately, and also the UK. Steph Ajeji Meme as well, I should say, is really the driving force for this work, and it's her energy and enthusiasm that has made it all be so successful so far. We also have partners who are here today from Fresh and Fuse as well, who are key in taking this work forward. And if I guess go to the next slide. So the work that we're doing here is very much working with a wide range of different community organisations. So these are all organisations based in South Yorkshire and the West Midlands, working with racially minoritised communities. So these are organisations that we kind of largely previously had existing relationships with, but we perhaps hadn't tried to bring them together, to work together to identify shared priorities. So what I'm going to reflect on today really is our experience of trying to do that for sort of the first time really, and particularly I suppose in terms of bringing together those two different geographical regions as well, and identifying kind of areas of priority and trying to work in very different ways to perhaps how we've worked with these organisations in the past. So we were really trying to do this, to really build these projects from the ground up. So we were working in a way that was very different for us as academics, but was also quite often very different for the community organisations we were working with as well. So we were basically coming into discussions and saying, we don't have a particular topic we want to work with you about. We don't have a particular method we want to use. We want to hear from you what would be helpful to improve your work. How can the university work with you to improve what you're already doing and to provide the kind of knowledge and evidence to support that? And we really wanted to do that in a way that didn't sort of emphasise that the university has that knowledge, but that recognise that those community organisations quite often have the knowledge themselves, and it's just finding a way of using the kind of language, kind of tools to actually kind of bring that knowledge to light and to share that more widely across the different organisations so that they can learn from each other, and we as well as academics can learn from what they're doing as well. So what we actually did, we had a lot of meetings. We had some face-to-face meetings. We had some sort of geographic sort of meetings in each geographic area. So some focusing on South Yorkshire, some in the West Midlands, some meetings bringing everyone together as well. We also had some online meetings. We worked with some community researchers, and we have Joshua here today, who is going to talk after me about his experience of being a community researcher on the project. And also producing a video, which will be very exciting. It's one of the first times we've shown this video to a larger audience, so that'll be good to hear your response to that. And also, we use a lot of other kind of flexible one-to-one approaches to engage people. So we had lots of, sort of phone calls with different organisations. We sort of use WhatsApp. We use other online tools. When we were having meetings, we also did various kind of interactive methods as well, and just try to really explore a range of different approaches to see what was the best way of engaging with different groups of people in the way that kind of made most sense to them. And we were really kind of trying to promote a different way of collaborating. So trying to bring different community organisations together, organisations that quite often had a history of having to actually compete with each other for scarce resources. So quite often they would find there were some tensions that we had to sort of work through with those organisations as well. So they might have previously, had instances where they've both gone, different organisations have gone to the same pot of money and one of them's got it, the other one hasn't. So having to work through those kinds of circumstances, and also trying to put aside the kind of the really hierarchical relationship between the university and these organisations as well, in ways that we've worked with them in the past, and acknowledging that there have been problems in the way that university and community partners have worked together. So it was about having some uncomfortable conversations and not shying away from that. And this is a kind of one of the phrases that was used by some of our participants as well, is about creating these brave spaces. So really encouraging people to have these uncomfortable conversations, not to shy away from it, and to acknowledge the problems of past relationships, and to try and look to the future, to think how we can do things differently, and to kind of develop ideas of how we might want to work together. So this was a one-year project, so it was really about kind of forming these kind of partnerships and thinking about how do we want to work together in a different way to how things have been before. We went through a process of kind of trying to identify different areas that people might want to work in, different kind of issues that they've been coming across, areas where it might be useful to think about generating knowledge. So there were various topics that came up. I've listed just a couple there about housing and also just spaces for people to gather together as well. We couldn't follow up all of these ideas within the School of Public Health Research. There were just too many different kind of ideas that came out of those discussions. But we also felt we couldn't really reject them either, because we'd said, we're here to listen to you and take on board what you're saying. So we kind of had to be a little bit creative in terms of what we did with some of those suggestions as well. So we did look at other kinds of sources of funding that we could support people to go for. So I'm going to give an example in a minute of where we did support a community organisation to get some other funding to look at their ideas in more depth. And we also found examples of where community organisations found they actually had more in common than they realised, and were able to link up with each other and take their interests forward together, separately from the School of Public Health Research as well. So this is an example of alternative funding. So SACMA is one of our partners in Sheffield, and it supports people of African and Caribbean descent around their sort of mental and social care needs. So we supported them, and particularly this was Steph really, supported them to get a National Lottery community grant to look at one of their kind of housing initiatives, a living campus for Black people with a history of mental health conditions and older adults. So that was very successful. It kind of took a bit of flexibility in terms of trying to fit that within the remit of what we were doing in SBHR, but ultimately that kind of built those trusting relationships with those organisations who could see the benefit of staying involved with the partnerships we're building and sort of working to the future. We also saw an example of different organisations who hadn't previously worked with each other getting together around a common interest. So this is an example of 3 organisations here who are now taking forward some work around sort of diverse menopause experiences. So the experiences of sort of racially minoritised women around the menopause, which have perhaps been neglected in the past. And then, but what are we doing within SBHR? There is the Clarity Plus project, which perhaps we should have called it something different because it looks very similar to the name of the previous project. But we say Clarity Plus because it's really building on what we did in Clarity and taking it to the next level. So moving from knowledge partnerships to what we're calling knowledge and action partnerships. So what can we really do about everything that we found out from the first phase? And working together to find new ways of valuing what these community organisations are doing. So in SBHR terms, that would be about finding kind of new methods of evaluation, but we're not necessarily using the word evaluation with our community partners because that possibly isn't kind of the most appropriate language or what, it's about how do we value what they're doing and how can we support them to show the value of what they're doing and also to look at, certain things which aren't perhaps working so well and to identify where to focus efforts in a way that kind of is based on their knowledge and their learning. So that's it, and I will hand over to Joshua now, who's going to reflect on his experiences of being involved in Clarity, and then show the video as well.
Thank you very much. Somehow I feel I'm overdressed for this occasion. All right, my name is Joshua Adejuigbe. From Nigeria, and my involvement in the Clarity Project came from my involvement in one of the community, which is Adaira, which talks about Black mental health. So coming into the country, I studied animal health and welfare in Nottingham Trent University, which gave me a bit of research experience, which I brought into the project. So Stephanie spearheaded the discussions we had as community researchers, and she brought us together to talk about challenges we faced and what the universities can do to research into it. And we highlighted a few things. We highlighted topics about unfair advantages in the job market for the racially minoritized. Sometimes we, the racially minoritized, try to apply for the same roles with the natives of the land, and first preference goes to that. And we also had a lot of other topics, which included welfare of international students in the Hall of Residence. We explored a lot of other areas in terms of information available to, speaking from my own perspective, to immigrants or to racially minoritized, but according to Adaira, to the Blacks. So we also spoke about the not enough networking because of the nature of people taking up these low-skilled jobs and not really having time to network and all that. So, and when we look at it, almost everybody I know is working on a low-skilled job, and it's from the community at which we come into, and indirectly we don't get UK experiences in this high-skilled job, so we got to talk about it. So I like to think of myself as a storyteller, people call us videographers. So I came up with the idea of how about we share some of these researches, because we have a lot of researches, a lot of knowledge flying around, but it's not accessible to the layman. We have a lot of journals that talk about situations that people face, about knowledge, about a lot of things, but the layman doesn't know it. Sometimes I feel like I don't even know enough about what is applicable in this land and what is not. So I suggested the idea of telling this story visually, like the speaker once that was here, who spoke about storytelling using a book. But we as videographers, we want to tell the story using videos. So which brought me into the Clarity project, into making the Clarity video, which explained the journey for 1 year about how we worked on the Clarity project. And Stephanie has been... Sorry. Stephanie has been... she helped me during the project. I got introduced to the project while I went for my wedding in Nigeria, just to come back and work on the project. And it's been a very awesome experience. And all right. All right, so enjoy the video.
Over a period of 12 months, the Clarity Project brought researchers and members of the public from across the UK together in new ways. We aim to create different ways of doing public health research. The Clarity Project was funded by the National Institute for Health and Care Research, School for Public Health Research. It has listened to those who face the most exclusion in society in order to consider ways in which public health issues can be addressed. This included people with learning disabilities, racially minoritized communities, people leaving the criminal justice system, and people living in deprived rural and coastal communities. We worked hard to ensure that we worked in ways which fit in with and supported marginalised community members and organisations.
Challenged our intention, challenged what the impact of the work would be and the likes, and then they had their own kind of priority, and which, you know, the representative communicated with me. And then even though it was not really the aim of the project, but I felt like in terms of creating and building that partnership and forming the partnership is something that we could support. So I helped them to organize what they want.
Today, when we talked about what topic we'd talk about, what the research proposal was going to be, and then the second day was deciding on a research question. So this was all about belonging we chose. The thing that really stood out for me for the whole experience was all the people who came had lived experience, so it was really nice to see their opinions valued and taken into consideration.
Through this program, then I tried to participate in the draft of the agreement, the cooperation, and also enhance me, and also make me improve, and also make me to understand more in this new country and this new city. And also benefit to me and also benefit to my communities. I think, in the future, I hope my opinions or the opinion from my groups that can be alert or aware by the local government. I think, it's benefit to everybody.
To come into the community to gain the views, which makes it easier, rather than expecting people to travel to them.
Building equitable knowledge partnerships had its challenges, and recognising these is an important part of building strong and honest relationships.
Raising expectations amongst the people that we're working with, because they're really interested and keen, and an amazing bunch of people, and they're ready to take the next step and work with us towards developing some exciting research, but we don't know where this is heading, and obviously academic funding is uncertain, and we're trying to iron out different pathways between us as a team, and just getting the balance right between being excited with the group but managing expectations is something that I'm finding quite tricky.
Because we have involved the unofficial groups in this research project to make it more inclusive, and that was the biggest challenge.
My name is Florence, and I would encourage our communities, especially the minority communities, to join the partnership, because this is something that is going to bring our profile to a better level, and also to make people understand the challenges that we face. We have the solutions.
However, there is a sense that the Clarity Project has shifted power from academics to community members.
What excites me is just giving people a voice and making sure their voice gets heard.
It's more of a one-way relationship. That was what happened in the past. But being involved in this, I think it has changed that direction of things. It has really changed in that we are forging a new way that universities are going to work with community centers like us, with the people, because they need us and we need them.
As the conversation developed over about 5 to 10 minutes, I suddenly had this light bulb moment that actually these people had interpreted the question very differently from me, but that actually what they were talking about were the things which were most important to them and their communities. And so I thought, oh yeah, this is what's meant to be happening. The power is shifting and the conversation's being taken in the direction that's important, not the one that I, as the academic, thought it should be.
Through building knowledge partnerships, we have co-created 3 innovative research proposals which tackle priority issues for people from marginalised communities in the UK. These proposals involve people from minority ethnic communities, those living in rural and coastal communities, those who have experience with the criminal justice system, and people with learning disabilities. We really hope that the projects that we have co-developed will go on to have real-world impact on the lives of people from marginalised communities. We'd like to end in the words of one of our community researchers who summarises all of our feelings.
I don't want the research to sit on a shelf.
Thank you very much.
So, Joshua, do you want to join us? Magdalena?
Okay, thank you all so much for fabulous presentations. You asked what we thought of the video. I'm just one person. I thought it was fabulous. Thank you so much for everything. But some instant feedback on that from me. So, opportunity for questions now for our speakers. Yeah, Matt.
Thank you. Thanks very much. That was a really great presentation. Well, series of presentations, so thank you. Something that's kind of come into my mind over the last couple of days in terms of like reaching out to and including and involving members of the public is that sometimes as a researcher, I find myself in a slightly false situation where I'm there as the researcher and other people in the room have the lived experience. But of course I have lived experience as well. And what to do about that? My lived experience is actually pretty privileged. So you know, is it relevant? Is it not relevant? Does bringing it in introduce a kind of personal honesty that allows a more honest, meaningful, less tick-boxy kind of relationship? So I kind of asked a question about that. I haven't quite worked out exactly what I think about it, but you know, people's lived experiences across the whole panel, you know.
It's grand. It's quite a large question.
I just talk too much.
I think we kind of touched on it yesterday as well, talking about trauma as well, didn't we, and some of the experiences that people are having. So I think there's certainly room for us to develop better processes to support people when engaging in this type of work, because there's the challenging side of listening to those types of experiences and then bringing your own experience, and that's something as researchers we have to balance. And early in your career, you thought you have to be objective, but I don't really subscribe. Well, obviously, we do have to be objective in research, but we also have to acknowledge our involvement, and that does influence the types of research questions that we ask, and we've all, as academics, engaged in that kind of philosophical discussion. I guess lived experiences brings that out even more, but yeah, it's a piece of work, perhaps, that could be taken forward, that could come out of this.
Yeah. Very interesting question. Yes, more questions for our panel. Yes, Rona. Oh, sorry. We've got
Thank you. Is it switched on? All right. I'm the father of a young man with a learning disability, autism, epilepsy, and so on and so forth. That makes me an unpaid carer. Now, I'm wondering, because when you went through the various groups, I was almost waiting for you to include unpaid carers, but you didn't. And I'm kind of disappointed, if you don't mind me saying so. I know there is other research going on in other places about unpaid carers, their mental health, and so on and so forth. But have you considered adding that group? Because there are a lot of us.
Thank you. That is a very good question. I think because this research was co-produced with people with learning disabilities, people who have a lot of experience in kind of, I guess, being excluded from conversations and spaces, it was not their preference. It was about bringing people with learning disabilities together and looking at what they want. I think historically in this country, if you look at the kind of, I guess, the activism around learning disability and the parent activism, there's been some clashes and maybe conflicts around power, capacity, and kind of, I guess, allowing the space to, for the voices of people with learning disabilities or other forms of communication, because not everybody communicates with words, to be kind of foregrounded. So I think because this was a partnership with people with learning disabilities, the focus was on that. It doesn't invalidate the need to think about the needs and experiences and, I guess, intersectional experience of unpaid carers and carers overall, but just it wasn't the focus of this knowledge partnership.
Did you want to come back on that? Is that no? Okay, Rona, I think Rona had a question there, yeah.
Thank you. I'll stand up because I'm right at the back. Thank you very much for those really interesting presentations. I was just thinking, with all your work that you've done on the programme, with the knowledge partnerships and working with these communities, do you have any advice when it comes to first sort of approaching community organisations to help build that relationship and collaborations for research?
I can start very quickly and just say that in my experience, it's about kind of thinking about what you can offer. Because we're asking of people for time and we're asking for the engagement, and it's often not very clear in many ways what is the benefit to the organization or in fact to the community that this organization is involved with. So kind of being, I guess, upfront about what is it that you're bringing and how it can benefit, how the research can directly benefit the community you're trying to engage with. And I think it's also kind of being equitable in our requests, so not overburdening, because a lot of the organizations are very small and they rely on a very small group of people to drive their work forward. And receiving a lot of requests about the same kind of work might be a bit tedious in many ways. So it's kind of maybe linking up with other people who are doing work in similar area to connect to groups that already exist, rather than trying to kind of cold call around as well. That's what I would say around work with people with learning disabilities.
Yeah, I would say as well that you need to sort of be sort of fairly recompensing people for their time as well. So, I mean, one of the good things about SBHR is that it really values that kind of, community involvement approach, and that you can put projects forward that have a decent budget for this kind of thing, and that's really needed, not to expect people to just, give their time for free. And also, obviously, it takes time. and that you probably will have to start small, and then it'll take a long time to develop those relationships and, you know, do more and more as time goes on. I don't know if you wanted to say something, Rebecca, because I know that you did develop some sort of new relationships in your project as well, didn't you?
So one of the things that I think was most important for us was honesty and integrity. And as Lois said actually at the beginning, going out and reaching out to organisations and saying we don't have a research question or methodology in mind was actually quite difficult. But we reached out to lots of different people, and you know, some came back, and I'm very grateful Trainee is here today. We formed a great relationship over the last 12 months, and with Hayley as well as the public partner. And there's been some challenges. We've had some difficult conversations, but also always trying to be honest and humble where we've done things that might have been harmful or not quite gone as we planned. Just trying to be honest about that and then move forwards.
Great. Okay, I think sadly we are almost out of time for this session, but thank you all again very much for really excellent presentations. Thanks for coming. So just before we close, we have some more things to celebrate. As you will have seen, we had some wonderful posters adorning the walls of the rooms that we had our breaks in, and we've had some amazing lightning presentations. And some of us have had the, has to be said, invidious task, I think, of trying to choose the best, because the quality was incredibly high, and that was an incredibly difficult job. But we have done that. But before I announce the results, I'd just like to thank Andy Sewell, who's just brought some goodie bags up to this stage, for all the work that she's been doing behind the scenes to keep that particular part of the proceedings going. And that's been quite challenging, I think, because just finding the judges and making sure we were in the right place at the right time. So thank you very much indeed, Andy, for all the work that's gone on and all the work that you do. So I have to give these to Ashley. Okay, so we're going to start with the poster prize. And the runner-up for the poster prize was Susanna Toos. If Susanna's here, would you like to come up and get her certificate? And one of the things that people making the posters were tasked with was thinking about inclusivity. We wanted, therefore, to commend Oscar Sharples for the very thoughtful way in which he did that and providing a QR code with a description of the poster as well as the poster itself. So if Oscar's still here, please come up. And finally, the winner of our poster competition is Anamika Basu. If Anamika. So congratulations to all of you. So moving on then to the lightning talks that we all heard. So the runner-up of the oral prize is Helen Hoyle, And I don't think Helen is here. She was only able to stay yesterday. So I don't know if Liddy perhaps is in the audience and who can collect the certificate on behalf of Helen and give it to her next time you see her. That would be great. So, yeah. And I said the decisions were difficult, and so they were. And so we have two joint winners of the oral prize, Daniel Mutanda and Rukan Khalif, if they'd both like to come up. So we're going. Many congratulations to all of you. So I'm just going to hand back to Ashley now, who's going to close the meeting.
Okay, so I'm just going to take a couple of minutes just to try and close the meeting. I don't know quite how you summarise all of that, so I'm not going to try. We just want to draw a couple of attention to a couple of things, perhaps, and say, first of all, just to congratulate everybody for being involved in the last 2 days, but actually 3 days, because ResNet meeting as well. We have had more than 60 people on this stage over the last 1.5 days. So lightning talks, public speakers, we've had practice representatives, so many different parts of our partnership represented here. And I think there's really been a theme in terms of that developing networks, connections, reaching out and talking to each other. And getting together in this way is a way that we can really do that and cement that. Laura, Tina, you talked about the importance of that in terms of developing a fellowship application, but we've heard it over and over again, thinking about connections and how we do talk to each other all the time, and we've done that over the last 3 days. But just to encourage you all to continue to do that through all of the different networks within the School for Public Health Research and beyond. So the other thing that we have heard about is the population health issues there are so many of them. And over the past few days, we could think, gosh, what difference can we possibly make? But I think we've heard over the last few days many examples of how we really can make a difference working together and working in partnership, and how we can evidence and support that change. Nassan demonstrated hope, I think, and value of the public voice, and how we can bring about change with the wider environment into the health of the public. I think you talked about going upstream and involving society and helping to give voice so that we can speak evidence-based truth to power. And it's our job to bring that evidence to that. So I think that's something that we've got that hope, and we bring that hope, and let's work together to make sure that that actually then makes a difference. And there's been so many examples of that. I have I think one of the things I've had of the last couple of days is how many different skills we've got, and how creative people are, and the importance of creativity. And I don't just mean in terms of particular kinds of practical skills, and research skills and methods and everything else. And we've actually had an active example of that. And somewhere or other I've left something. So Rona, I'm going to ask you to bring that box to me. Thank you. Thanks. So we've had it happening in practice as we have all been sat here. And we've got these drawings of the different research programs, and that Chloe has been drawing as we have all been sat here talking about our research programs. So that's research and creativity in action. And I just want to say thank you to Chloe. You've been tweeting these, and we've got these available to us, and they're beautiful. So thank you. And there's so much, a picture tells 1,000 words, doesn't it? And we've had many thousand words, but look, we have these pictures. And obviously we've got another program to add. So Chloe, we've got a little gift for you here if you'd like to come and get that. So we didn't know we had another prize, but we did, and aren't they? So I'm going to leave those up, and I'm just going to finish with some thanks. So I want to start by just reiterating my thanks to the Scientific Programme Committee, to Miranda and to Frank, and all of the people who supported the putting together of the project. Of the programme. I want to thank all of the people who've presented posters, and they've been fantastic, and I think all of them, we've recognised some of them today, but they were all wonderful. And also to all of our speakers, because 60 people up here, it just has been fantastic. We've had great support from the hotel and from the venue, so thanks again to Birmingham and to Fresh for hosting us. John, thank you for all the photographs. There's some beautiful photographs emerging, and we'll be sharing those, so there'll be individual images and groups. I'd like to just thank Beacon House, to Katie and to Callum, who've been running around in the background and keeping us all on track. And I also would like you all just to acknowledge the directorate team. We have a small but beautifully formed directorate team. And I'd just like them all, if you wouldn't mind, just to stand up. Susan is already standing. She always is because she's running around. But if the rest of you could just stand up. Amy, our comms officer, Katie, our knowledge broker, Andy, who we've already thanked, and Laura Fennick, who you get so many emails from. So yeah, small but perfectly formed, and they achieve huge things. So thank you all to you. Thank you to everybody who's helped chair the proceedings, to Painame, to Rona, to Miranda, GJ and others that have been up here chairing. I think we've had an amazing showcase of all of the research that we do, and we haven't shown even half of it. So we look forward to seeing everybody back next year. I'm not sure we've quite decided where ASM is going to be next year, but we are definitely going to be somewhere. Is that okay for you, Peter, in terms of geography? Yeah, we will be somewhere in England. Like, I'm really quite specific, okay? Somewhere in England to be revealed. So my final thing before I close the meeting is to say that you will all get an email after this with some feedback. Please do give us some feedback, because we want to know, does a day and a half work? The ResNet, then the day and a half, does that format work? And is it good to be all together? Do you want breakouts? Just tell us what you would like, and we'll do our absolute best to accommodate as many of those views as possible. I'm managing expectations, can you tell? Obviously, we can't please everybody all of the time. So thank you. Please do complete your feedback. Thank you to all of you, because you can't have a meeting like this without people contributing, participating, asking questions, and also being on the platform. So thank you to all of you. Safe home, and we'll be in touch.